for braving the cold weather to share in this ceremony celebrating our long-anticipated and well-deserved leap from being successful students of nursing to very grateful graduate nurses. My name is Adrianne Keller, and I am truly honored to have the pleasure of addressing you this evening. I must admit I was surprised that my classmates chose me to speak tonight, being that I'm one of the more quiet and reserved. Well, honestly, I'm quite the opposite. On occasion, my contributions may have led to digression and distraction, much to the dismay of my professors or study groups. The time is upon us, and all the hard work and determination we've exhibited over the last few years is finally coming to fruition. We are eager to embark on our nursing careers, look forward to opportunities that will build upon our strong educational foundation and Franciscan values. As we end our journey as classmates at Marian University, we reflect on a few unique qualities of our class that have helped pave our road to success. Friendship was invaluable. Friends were forged by the action of classmates, such as a fellow student calling the morning before a test, functioning as a backup alarm clock. Or when a friend insists you attend class by grabbing your wrist and dragging, completely ignoring your flimsy argument that attendance during the first week of the semester is considered optional. Thanks, Nicole. These bonds of friendship fostered a spirit of unity, able to motivate and inspire us in moments of frustration and self-doubt. The phrase, "we started together and we're going to end together," became a class mantra. The desire to learn how to provide the best care for our nursing patients was the overarching goal of our nursing class. We learned from the vast knowledge and experience of our instructors, as well as the unique insights and perspectives of our classmates. Learning opportunities were also found in each experience with the patient. I'm sure at some point we will all look back fondly on how nervous we were as students, such as the first time we administered an injection to a patient, a real life human being, that is. I remember shaking like a leaf, kind of like I am now, and being extremely worried that I was going to use an improper technique, leading the patient to begin screaming or crying. Thankfully, the patient reported he felt no pain, which taught me the lesson that I needed to enter situations more confident in my knowledge base and skill set. The third quality I found instrumental in our progress as nursing students was maintaining a collective optimistic outlook. By being just as enthusiastic about the success of others as we were about our own, we created a classroom environment of hope and optimism. We achieved our goals by thinking only of the best, working only for the best, and expecting the best. In our careers, we can continue cultivating optimism by wearing a cheerful countenance at all times, and by talking health, happiness, and prosperity to everyone we meet. Friendship, learning, and optimism were prominent themes in our nursing program. Combining the first letters of these three words spell flow, and Florence Nightingale was a pioneer in the nursing field as well as a source of inspiration. She once said, "I attribute my success to this. I never gave or took any excuses." In addition to avoiding excuses, our class would not have achieved success in the pursuit of this endeavor without the limitless support, encouragement, motivation, and inspiration offered by our family, friends, faculty members, and classmates, and for that, we are forever grateful. In closing, I ask that my fellow classmates plan and implement a treatment for your final patient, care plan. You're the patient this time, and you have spent the last few years battling the exhausting student nurse diagnosis. The diagnosis is defined as ineffective tissue perfusion related to long hours of studying for exams, as evidenced by decubitus ulcer on gluteus maximus, and no feeling whatsoever in lower extremities. I hope we all arrive at a treatment plan that includes a victory dance, and I wish you the best of luck and hope that, in the words of Ralph Waldo Emerson, you do not follow where the path may lead, go instead where there is no path and leave a trail. Congratulations, graduates, and thank you.
Thank you, Adrianne. I'd like to present the history of the nursing pin. Students of the BSN graduating class in 1991 originally designed Marian University's BSN nursing pin. The student's goal was to indicate the interrelationship of the nursing program within the Marian University community. The blue and gold symbolizes Marian's colors and was designed with the Marian University emblem in the center. It encircles the Latin phrase, Sedis Sapientiae, meaning seat of wisdom, which refers to Mary in whose lap rested Christ, the wisdom of God. The lamp of knowledge is placed below the phrase to symbolize nursing's commitment to knowledge and caring in the rich tradition of Florence Nightingale. Both the seal and the lamp are placed on the cross, signifying that nursing is centered on spirituality and caring. Encompassing all of these are the words, Bachelor of Science in Nursing. I would like to introduce Father Dennis Bossi, who will bless our pins.
Before I actually bless them, it's been a privilege to see Marian nurses out in public. You can almost tell who a Marian nurse is outside of a hospital. I've met Marian nurses at a Taco Bell, at the express line at Kroger's, walking through Walmart, going to the hospital, and going to the emergency room myself and telling two graduates of Marian University that I had H1 and N1, seeing them make the mad dash out of the room and coming back in all dolled up. I didn't know the nursing program had a track team tied in with it. But yet, as part of the blessing, what strikes me most, and was said before, is that yes, you are graduating as professionals, but yet professionals with that human touch, with that smile, with that caring touch, and recognizing that it is not just a profession, but actually being the extended hands of God who always heals us. You are there to listen as if Christ listens. You're there to speak as if Christ was speaking through you. You're there to provide comfort as Christ provides comfort for everyone. So wear these pins as a sign of great accomplishment, but also wear these pins in that you are deep-rooted in your spiritual relationship with God. And so I bless these pins in the name of the Father, and the Son, and of the Holy Spirit.